If I had to do it over again, 45 would have been the latest I would have waited.
As a mother, you never want your child to be sick.
I might have a small pain in the morning and then it was gone after a couple minutes. I didn't really have any signs or symptoms. I had a week where I had some transient, like once a day I'd have a stabbing pain in my abdomen, and that went away. I even talked to a doctor and they said, take some Gas-X. So I pursued it a little more and went to a gastroenterologist, and they said, let's do a colonoscopy. Waking up after the colonoscopy, the first thing I heard anybody say was large tumor. The gastroenterologist said, of course, we'd have to wait for the path report, but he was pretty sure it was cancer. Got an appointment with a surgeon before the path report came back, and we had already scheduled my resection. They had planned to do a robotic resection, but where my tumor was not where they expected, so they ended up having to just open everything, and that's how they found I had stage 4 colon cancer with peritoneal mets.
And her doctor told your family's got to go do a colonoscopy. So then we scheduled our colonoscopies.
Did her colonoscopy, and unfortunately, she was found to have a large mass. The biopsy came back high-grade dysplasia. So it's not cancer yet, but it is at risk for turning into cancer. So she's going to require a resection.
To follow your doctor's advice, do your colonoscopies when they need to be done. Don't put them off.
If you have a family member that's been diagnosed with colon cancer, we typically use the rule of normal to cancer takes 10 years. If you have a family member that was diagnosed at 40, you need to consider getting a screening colonoscopy at the age of 30 if you are a first-degree relative of that person.
If I was speaking directly to someone who had colon cancer, I would say advocating for yourself is imperative. It's your body. Nobody's going to find that as important as you do. Spend the time that you can doing research to find answers for yourself, to know what you're talking about. There's a lot of acronyms. If you're not familiar with cancer, it's a whole other language. And so if you can educate yourself on how to speak well to your doctors, that would be helpful.